Maternity-Care-Coalition was founded in response to the high rates of infant mortality in Philadelphia that rivaled those of developing countries. Our goal was to reduce preventable infant deaths by improving accessibility to existing maternity services, by helping targeted neighborhoods develop new community-based services. We have 5 strategic priorities. We aim to demonstrate our impact, to prove that our services have a lasting effect on the communities we serve. We focus on the big issues, seeing the full range of challenges facing our families, be they rooted in health, education, policy, or poverty. We want to serve more people, providing evidence-based programs for each parent and child who needs us. We aim to run an exemplary early Head Start program, providing free, quality early care and education that will ignite a lifelong passion preparing children for school who, without this service, would start at a disadvantage. Finally, we want MCC to be a flexible and sustainable organization, ensuring that the families who need us obtain the services and support they need quickly and efficiently. To get there, we need individuals and organizations that are committed to helping us advance our mission of improving maternal and child health and well-being. MCC is successful because we're committed to improving maternal and child health by serving our clients in their homes. Many of our advocates are recruited from the communities they serve, bringing an in-depth knowledge of client needs and connections to community resources. We're also the voice of families, having built strong relationships with policymakers at all levels. These help us advocate on behalf of childbearing families on issues such as access to health insurance, maternity rights, and even successfully passing legislation prohibiting the shackling of pregnant incarcerated women during childbirth. Whether it's in the community, on the news, or in legislative meetings, MCC is a respected voice and a champion for women, babies, and families. There are organizations that only work with women or children, but we work with both. Our comprehensive and holistic approach to maternal and child health helps us know what to advocate for, improve service delivery, and provide more evidence-based interventions. We're governed by a strong and diverse board of directors and led by a highly accomplished leadership team. We also use impacts and outcomes across the organization to set our goals and measure our success. We use a sophisticated client data management system. Our advocates enter large amounts of data related to our clients' health history, demographics, and future goals. The data shapes the program on a daily basis. It's used to identify and monitor client needs and goals and perform continuous quality improvement. Additionally, we provide evidence-based services through our nationally recognized Mommobile, Healthy Families America, and Early Head Start programs. Our metrics focus on 5 strategic outcomes: parenting, health and healthy behaviors, social and instrumental support, medical utilization, and empowerment. Our Mommobile advocates conduct home visits. Families and other members of the community recognize our colorful Mommobile vans. Often, however, people mistake our van for a medical van where people receive prenatal care, rather than a brightly colored vehicle used to advertise our services and transport our staff for home visits. Because of the wide variety of services we offer, MCC is often classified as a maternal health organization, or one that focuses entirely on early childhood education. Our scope, however, is greater than just one issue. We offer services that includes health, parent and child education, as well as public policy and research. We address the full range of issues affecting pregnant women, families, and young children, which sets us apart from other organizations. A vigorous analysis of our Mommobile service revealed a large decrease in the number of women at risk for perinatal depression. Next to comparable programs in the state, our clients have a much higher breastfeeding initiation rate. Also, almost all of our clients are putting their babies to sleep safely by laying them on their backs, compared to 65% of women across Pennsylvania. Furthermore, an empowerment study, women report more confidence and a greater ability to care for themselves and their children. We have often been challenged by a lack of funding. For example, state funding for workforce development formerly funded MCC to help women on welfare adjust to parenthood and return to job training or work. The elimination of these programs has left our programs with fewer staff and longer waiting lists. We recognize the vital importance of identifying new sources of funding from individuals, businesses, and foundations. Every additional source allows us to have a greater impact and to strengthen families and inspire change. We could serve greater numbers with more resources. All of our services have waiting lists. It breaks our hearts to ask pregnant women and babies to wait. We need resources to help pregnant women manage chronic health conditions such as diabetes, hypertension, and depression in our unique efforts to improve the health of the mom as well as the baby. We could also continue to work with employers and hospitals to make them more breastfeeding friendly. We believe a mother's breast milk is the optimal first food for babies. We would relish the opportunity to expand our current programs, providing early Head Start and Mommobile services to all families who need them, providing cribs and safe sleep information across the state, researching new methods to keep us at the cutting edge of our practice, and advocating for childbearing families, infants, and toddlers. We aim to further expand our doula services across our Mommobile programs, providing support for women before, during, and after labor. Additionally, we'd expand our parent engagement program, allowing our early Head Start enrolled parents to play a role in the development of the program. Moreover, we would like to invest in more technology, spreading the word about the Text for Baby program, of which we're a partner, which has proven health outcomes for low-income pregnant women.